had to guess out of these 4 interventions, which lowers your blood pressure more? Endurance, resistance training, a combination of the two, or isometric resistance training? Well, if you're like me, chances are you got it wrong. Welcome back to the channel where we break down complex science and health information so you don't have to. If that sounds interesting to you, please consider subscribing to the channel. And if you know someone else who might consider this valuable, please go ahead and share it with them as well. So let's dive into it. In short, blood pressure is the pressure of circulating blood against the walls of blood vessels. We know that high blood pressure, which we call hypertension, is a major problem that plagues our society today. By definition, hypertension is the chronic elevation of resting arterial blood pressure of greater than 140 millimeters of mercury, which is our systolic, and greater than 90 millimeters of mercury of diastolic blood pressure. Hypertension remains one of the most significant modifiable risk factors for all of cardiovascular disease. And get this, nearly 1 in 2 adults has hypertension. It's crazy. To solve this problem, 80% of those individuals with hypertension are given prescription medications in conjunction with lifestyle recommendations to fix their issues. A lot of these lifestyle factors are things that, if implemented alone, would make a huge difference. For example, lose extra body fat, exercise regularly, eat a healthier diet, which we know is less processed carbohydrates, quit smoking, reduce stress, etc. And I encourage all of those for everyone and anyone dealing with high blood pressure. But here's what gets interesting. We're in the process of building a badass app for Aspie that will be able to look at several health markers of health, blood pressure being one of them, and combine it into an algorithm to tell you your biological age and provide specific recommendations for how to improve it. If you go to your typical doctor with high blood pressure, you'll likely get the same old, oh, you gotta lower your salt intake, you gotta stress less and meditate, or even take this drug daily. Obviously, that's not gonna be our recommendation. Rather, we want to see what type of exercise intervention people could implement to improve their blood pressure. So, there was this meta-analysis that compared greater than 5,000 subjects who implemented resistance training, endurance training, the combination, or isometric resistance training in healthy adults. So here I am. I'm looking at this study because I want my parents to be as healthy as possible, especially since my dad has actually been hypertensive in the past. And while I encourage all of the above behaviors, we're trying to find things that anyone, anywhere will do. So I'm digging through this study, and you obviously see benefits for endurance training, dynamic resistance training, and combined training. But get this. This is the craziest thing I've ever seen. The largest effect sizes came from isometric hand grip and isometric leg exercises. So in essence, isometric resistance training may have the largest potential for reductions in systolic blood pressure. So I'm looking at this and I'm like, I have to dive deeper into these studies. So I find this one. They took 72 hypertensive individuals. They were 38 to 79 years old, 70% of them being female. The protocol was something every single person that's watching this video can do. 3 times a week. For 4 sets of 2 minutes, they squeezed at 30% of their maximal voluntary contraction with 1 minute of rest in between bouts, and then they alternated hands. The main finding was that 12 weeks of this isometric hand grip training significantly reduced brachial blood pressure and demonstrated for the first time that isometric hand grip training can decrease central systolic and mean blood pressure in hypertensive individuals. This reduction, which was like 6 and 4 millimeters of mercury, respectively, are estimated to reduce the risk of cardiovascular mortality by 25%. So you can literally test this out for yourself. You can go on Amazon, get one of these hand grip things. They're super cheap, super inexpensive. You can buy any blood pressure cuff, measure yourself at home, and then do this protocol for the next month or 2 months and see what happens. But I encourage you this, do not use this as an excuse to stop exercising or eating better. But if you know someone or yourself is hypertensive, get a blood pressure cuff and do this isometric hand grip protocol while watching the next episode of Stranger Things. And who knows, you could reduce your risk of cardiovascular mortality by 25%.